everyone, Dr. Luke Peterson here, physical therapist with the Knee Replacement Therapist. In this episode of the Knee to Know Show, we're going to go over some of the best sleeping positions to improve your sleep after knee replacement surgery. Hey everyone, so one of the biggest struggles after knee replacement surgery is getting to sleep and staying asleep and being able to sleep comfortably for prolonged periods of time. Due to the swelling and the pain and the stiffness and all the things going on with your knee, it can be really difficult to find a comfortable position to sleep in at night. So I want to show you some of the best positions that I've found for sleeping after knee replacement surgery. Of course, everyone's going to be different, and it really takes some guess and check to find the position that is most comfortable and most tolerable for you. So first off, I want to say that your best friend is going to be pillows. So as many pillows as you have and lots of pillows, and experimenting and using different pillows is going to be really helpful for you. So first, let's talk about laying on the stomach. So not many people tolerate laying on their stomach after knee replacement surgery for a variety of reasons, but one being that your knee is in a relatively straightened or extended position for a prolonged time, and that can tend to be not very comfortable. But some people do like to sleep on their stomach still, even after knee replacement surgery, so let's go over that first. So typically when you're laying on your stomach, like I said, your knees and your legs are basically in this straight position for a prolonged period of time. So what we can do is, if you take a pillow, and you can either just use one pillow like this, or you can take multiple pillows. So you can stack up more than one pillow, or 3 or 4. And now you're going to put your shin on those pillows, or you can even put your whole knee up on the pillow, or you can make it just so your shins are on the pillow and your knees are off. And basically what we're trying to do is have a little bend in the knee. You can also, of course, fold the pillow over to give it a little more girth. So you can have the folded pillow. Obviously is going to allow a little bit more bend, a little bit more comfort when sleeping on your stomach. The next one I want to talk about is laying on your side. I would say probably the most common is to lay on the side for whatever reason, but there's a lot of people who will either lay on their side or on their back when they sleep after knee replacement surgery. So again, we want to use the pillow. It's going to be our best friend. So you can lay on the same side that you had surgery. So some of the benefits of that, of laying on the same side, so if my right leg was the surgical leg, some of the benefits of that is that the surface and the mattress actually provides some stabilization of the leg and puts it in this more neutral position. You know, it can be straight, it can be bent, but in terms of side to side, it's stabilized at the hip, stabilized here. Some people tolerate that better. Some people tolerate laying with the surgical side up, so it's a little bit more elevated and not as much pressure through the surface. When you're on the side, again, using those pillows, so you can put it between the knees here, like this, and that puts that hip and pelvis in a little bit more neutral position, a little less stress and strain. You of course can fold it up to make it a little thicker. You can add more pillows and make it even thicker if you want. You can have the leg relatively low, or you can really get the pillows up nice and high if that feels more comfortable for you. Whatever feels more comfortable. And the same exact thing if you were had the surgical leg up rather than down, you would do the same exact concept using those pillows between the legs to provide that comfort based on what you feel. Again, some people might have one pillow, some people might have a bunch of pillows. It doesn't really matter, it's what feels comfortable for you. And the last one is laying on your back. So again, with the pillows, you're laying on your back, and sometimes what people want to do is they want to put it right under their leg like this, and right under the knee. Now the problem with this, early on after surgery, is we don't want to have that knee for a prolonged time be in a flexed or bent position. It's really important early on after surgery to restore that extension or straightening range of motion. Once you've achieved that ability to fully extend the knee, hopefully within a week or a few weeks after surgery, then it's okay to do this. It's not as big a deal. But early on after surgery, it's important to not necessarily have this prolonged bend position. So the alternative is basically putting the pillow lengthwise. So along the whole lower part of your leg, going up the leg like this. And as you see, there can still be a little bit of a bend in that leg, but it's much less significant. Again, with the pillows, so we can start to stack these up. As many as you feel comfortable. You can put, as many pillows as you want, so your legs all the way high up in the air. If that feels more comfortable, that's perfectly okay. Another thing you can do is you can get a wedge. So a wedge is basically just like it sounds. It's a foam wedge with a covering over it. And that is another way that you can elevate the legs. You can put the wedge under your feet or your legs, or you can put the wedge and then some pillows on top of the wedge and put your legs on top of that as well. Another strategy that you can use if you want to get a little more bang for your buck from the amount of pillows you have is if you bend one pillow in half and then put the other on top like this, and then you kind of have created a wedge just with those two pillows. So you have one pillow in half, and then you have the other pillow resting on top of that lengthwise. So you create a wedge in that manner as well. Again, it takes a little guess and check, finding what feels comfortable for you, and it may be different one day to the next. Another thing I want to share is full body pillows. People tend to really like using a full body pillow. So laying on the side, you can put it between both legs. You can also just keep your lower leg straight and just put the top knee on top of the pillow. So you might not have it necessarily between both legs, but just have the top leg on top of the pillow like this and can kind of cradle it. Same thing, you can use it lengthwise. If you're on your back, you can maybe put it over like this and put the leg on it. You can bend it in half and elevate it up like that. So a lot of different uses for the bigger full body type pillow as well. It's just another option for all of you out there. So hopefully between all of these different techniques, you find one that is at least somewhat effective for you, helps you to get as much sleep as you can possibly get. I know it's a real struggle early on after surgery, so be sure to check out some of my other videos that share some tips and tricks to also further improve your ability to get a good night's sleep after knee replacement surgery. So thank you very much for watching, everyone. Be sure to subscribe to our video and hit that button so you get notifications whenever we post a new video. Everything related to knee replacement preparation, recovery, frequently asked questions, details about the surgery itself. Thank you again for watching.